I just like the way that we ride. I wanna keep you around. Every single day, every night. I wanna let you know that I'm down. Down. I just wanna keep you around. And every single day, every night, I wanna keep you.
What's up, hopefuls?
Hello, everyone.
All right.
Welcome back to Harris Hope and Humor, where we share our lives as entry-level couple. And this episode is about our hip update.
Yes, the last hip update, hopefully.
I think we need to do like a finale, like a party update, like a celebration, a celebratory update.
All right, so today is April the 18th.
April the
18th. We are exactly 4 weeks out from the surgery.
Yes.
Plus a day. Yeah, whatever. So basically, the surgery was not as complex as initially thought. Originally, they were supposed to go in, open the hip up, extract some of the bone out, then take some of my muscle from another part of my thigh, fat and muscle, and fill in the gap and all that good stuff. Recovery was supposed to be about 4 to 6 weeks. Stomach bed rest, basically, was what I was told. And thanks be to God, it wasn't that intense. They did take out my bone. If you're squeamish, if you don't like x-rays, don't look at the next 20 seconds.
20 whole seconds?
15.
15, that's a long time.
Okay, 5. It's over. It's gone. But they took out a little piece of my hip, and they didn't fill it back with nothing. So there literally is. It's weird. Like, you would have to see the picture to understand it. And I always request for my X-rays. People always oblige me. But I did not. Okay, they did the surgery. They did not have to do the flap. They was able to use the skin and muscle that I had and just suck me back in together. So basically, I got like a tummy tuck on my hip, but it's still big, so I don't know what to do. I'm excited about that. I'm glad about that. I think I'm a little upset because the surgeons didn't explain a lot to me afterwards. I slept through my anesthesia had me knocked out, and I slept through my after post-surgery consult. My wife did talk to the doctor on the phone, but I never got to see I haven't seen either one of my surgeons, like the actual people inside of my body, since I've got operated on and we're mobile. I find that odd. I find that annoying. I find that frustrating because when I was recovering in the hospital, I was hearing different things. Some people, I didn't know I didn't have the major surgery. I didn't realize that till maybe 3 days later when physical therapy came in. So people was asking me if I was supposed to have another surgery to remove the beads, because that's what I was telling people. I'm like, oh yeah, they put antibiotic beads, because that's what they're supposed to put into my hip. So I'm telling people, yeah, I had antibiotic beads. I'm like, I can't put pressure on the hip. Don't let me sit up too long.
Can I backtrack?
Yes.
Okay. So Leon had the surgery. I get the call that the surgery. So it started out kind of good. There was like text messaging to be like, the patient's in post-op, pre-op, and then it was like the patient's going back to surgery. So I was like, oh my God, this is amazing. Like, because it was that big uncertainty of like what it's like to be in a different hospital system. University of Penn is a major hospital system in Pennsylvania. They do a lot of research. They do, they do a lot. So you kind of never know what to expect. So the surgery happens. I get a phone call from the surgeon, and this is the orthopedic surgeon I get a phone call from, I believe.
You told her to go back, so that's the plastics.
Plastic. Oh, okay. Plastic surgeon. I don't even remember who I talked to. And he was basically like, everything was over it. Leon did well. And he's like, we didn't even have to do a full muscle flap, but like didn't really elaborate what that meant. So then I kind of started asking questions about like, okay, well, did it change what his recovery will look like? He said that it didn't, because it would still take, about 4 to 6 weeks for him to fully heal. you know, did it change how he was sitting in his chair? He didn't really have an answer. He kind of was like, oh, well, it would be better because we got rid of all of that, like, kind of like infected bone. But, you know, it was kind of like a blasé, like, this is just a formality. So they were supposed to put the antibiotic pearls in to help kind of kill off the infection, like make sure it was gone. And then part of his post-op was to be in the hospital for a few days. And they checked to see, they took cultures to check to see if anything grew. And then I guess what grew was different from what they were treating. And so that's why there was a lot of questions about whether or not they were going to have to go back in to remove the pearls. Because I guess there was a possibility that the pearls, antibiotic pearls, wouldn't have been effective for the original infection. But that we learned from a friend, not even from his time actually in the hospital. So that's what he's referring to about, like, it was people asking questions and there was like a lot of stuff that weren't really answered. And I guess at the end of the day, the pearls didn't happen.
No, I had asked I just eventually asked my nurse, can I just see the discharge notes, see the notes from the surgery, just so I could see for myself what was done. And it basically was just the Girdlestone procedure, or arthroplasty as they call it, of the right hip, and some fancy word for saying that the skin was put together. Yeah, there was no pearls, no rotation of muscle or anything like that. And when I found out that I could have a little bit more mobility was when PT showed up at my door one day. It was just like, yeah, let's get you in a chair. I think it was like maybe day 2.
Yeah.
I think it would be like day 2. And I'm just like, what? And that's when I found out I didn't have any quote unquote restrictions. One restriction was don't put pressure onto the site. And because of where my wound is at, it's not on my butt, it's on the side of my hip. So yeah, so like sitting in my wheelchair, technically I'm not putting pressure on it. So, you know, I got in my chair, did my thing, rolled around a little bit, took a lap around the floor, and got back in bed and felt pretty okay. You know, I was just a little tired and my hip hurt. It's odd to say it's a quadriplegic, that my hip hurt, but it hurts. It's actually hurting a little bit right now. But yeah, and I ended up only doing, I might have did 4 days. I might have did 4 days in the hospital. They said 5, and it was 4 because there was an issue. They wanted to put me on a PICC line, and I vehemently refused. Which is an
intravenous catheter to treat infections.
Yes.
Like an IV.
And to go home with. And I just had one in February, and it caused a blood clot, and I didn't want to chance that again. So I asked the infectious disease doctor if it's possible, if there's any oral antibiotics that I could be on that was just almost as comparable as being on IV. And they worked with me. It was a little back and forth, and it was the weekend, but they worked with me. Which I think was interesting that a hospital that big that does so much would not do that particular procedure on weekends. They didn't do nothing on weekends. But they see so much. They didn't do anything on the weekends. The nursing staff was great. I had an issue with one of my rooms where it smelled like somebody was smoking in the room. Because whatever system they had, filtration system, didn't work on the weekends either. Yeah, it was weird. It was like I had a room that was I had a room basically in an alley. So a couple people were saying that because whoever come out the alley down there and smokes, the smell comes up to the 5th floor and somehow seeps into your room. And I thought it was a bunch of baloney because when I went back to the hospital, I almost ended up in the second room I got, and I asked people, I'm like, is that room over there I was in before smell like cigarettes? Like, no, never. It was weird. But I made a big fuss. I was able to, I actually almost threw my I almost hopped, since I knew I could get in my wheelchair while I was cramping, I almost got in my wheelchair and pushed my hospital bed out the room because I just was tired of sitting in cigarette smoke. It felt like a bar, and I don't like nicotine. But I got on Sunday, I guess the 21st. I don't know what the 17 plus 5 for 4 days. I got out that Sunday, came home, transferred into the car. It was okay. It hurt a little bit. It was uncomfortable, but it wasn't too bad. And I stayed in bed, I think for like the first week or so. For about a week and a half, I stayed in the bed. Like an hour out of bed, and even that was like a it was really short. Yeah, it was really short. I did so there was a couple of videos like me outside, like just for a minute or two, but I took it really, really easy. I had physical therapy. Physical therapy come to the house. I think that second week, and she had me working out with her, getting in my chair, for about an hour, once, maybe twice a week with her. And then about that second week, and towards the middle of that second week is when I started feeling my groove coming back. I felt like I could sit in the chair a little bit long, so I think I cooked. I think I did some dishes or something like that. Then the next day I might have did laundry or something. Then I took a break to rest my hip. While I'm always watching the JP bulb that I have on my hip, which is a drain that's actually goes all the way to the hip bone, but it comes out of my body that way to get the blood and the fluid out.
Which, like, at first it was like, oh my God, this is so great. There's not this like open wound that's leaking and draining and it like smells, and it was like, this is the beginning of the end. And
then that second and a half, somewhere on a Saturday, I just felt yucky after doing my bowel regimen.
I think it was you started to feel bad on the Saturday.
On Saturday I felt bad. I managed my way through school for 3 hours, and then after that I just slept. I think I slept a day away. Don't think I checked my temperature until later on that evening. It was like 102, but I didn't like the thermometer, so I checked it again. I think it was still like 101. Took some Tylenol, tried to knock it down, drank some tea, whatever, still relaxing. And then Sunday came, it was actually good. Noelle went to her cousin's, I think, and I ended up throwing up. In spite of this, I had called my visiting nurses that I had. I called them on Saturday. Hey, I don't feel well. I have a little fever. Just letting you guys know. What should I do? And somebody called me back. Nobody called me. I actually asked for somebody to come see me.
Yeah, you did get a call back. She offered to come that night, but it was like 10 o'clock at night.
And I knew her, and I was like, no.
Yeah,
like,
and
no.
she wasn't sure if that was even like in their protocol to come out that late. So we were like, as long as somebody knows, like at least we know you got the call. We'll see somebody tomorrow.
Yeah.
And then that never happened, despite multiple calls.
Yeah, and then, I called
and then
back
finally,
again.
When it was time to go pick Noelle up,
I threw up, and I'm like, out of caution, we should just go. So I called I called the nurse again, and they had a nurse call me right back, I guess, because I said I vomited, and said go to the ER. And
so he went to the ER closer to us as opposed to where he had the surgery at, and then they had him transferred back to where he had the surgery at.
Yeah, because they say surgeons don't like touching other surgeons' stuff, and I get it, but it was also like, ugh. So I went back to Penn for 2 days. It was fine. They didn't really do anything. They taught me how to milk the tube, which they should have taught me before I left. I had seen the doctors do it. I never saw a nurse do it for the 4 days I was there, so it was kind of weird. Like, if somebody would have told me this, because the reason I thought I had an infection, excuse me, was there was buildup of fluid inside of the hip. And for me, I know how sensitive my body gets to fluid and stuff just sitting in my hip. Yeah. It causes my body to think I have an infection and wants to fight it. And I didn't. Increasing
to be like lethargic.
Yeah.
Temperature, the vomiting.
Yeah.
Like all like your typical something's not wrong. Right. Yeah. This might be an infection. And we were like, okay, well, can't be the hip because we just fixed that. So, and then we thought it was like a UTI. And then we were like, everything in the urine looks good. And lo and behold, it was basically like, I guess the 2.5 weeks of not milking it.
It was just a little fluid backed up once they did a CT and all like that.
Yeah, we started wondering, oh my gosh, should we have did the PICC line versus like the oral antibiotics? So we make like a bad decision with that. And
and I was going to come when I went to the pen. I was like, all right, I'm gonna be open to getting the PICC line. And then once they described what happened, I was like, nope.
Yeah, because they were talking about putting a bigger drain in.
Yeah.
And infection disease was like, well, no, it's not worth the risk to like have to open it back up to change out the drain. So then he was kind of like, well, if that's too risky, then so is putting this PICC line in because that's just as invasive.
And since I didn't have an infection, like it wasn't like I had an active infection. It was just
right. Which they're like, of course, from going from one hospital to the next, his labs were all like screwed because they started to treat him with the antibiotics at the first hospital, which will make all of your numbers look weird because now you already have antibiotics, which will kind of like change like your white cell count and different stuff that they're going to look at because it's already like they're already kind of like one step ahead of it.
And I can tell they're not used to patients advocating for themselves and knowing their body and knowing their their labs, because every time I would I had to fight with them about it. I'm like, my labs didn't look right. Like, they didn't believe I had an infection or had symptoms of an infection. But like, if you look at the labs and compare it to old labs of mine, something was off. But it got worked out. I got sent home the next day. I stayed on the oral antibiotics I was on, came home. A lot more tired from that little hospital stay. I think it took me about like a week to bounce somewhat back to my regular self. And I think with now, what, with 4 weeks left?
Because I feel like you just knocked yourself out. Like, you know,
still,
whole 4 weeks.
I'm still not myself. Yeah, like right now I'm leaning and hunched over. I'm tired. I like to be in the bed a lot. I'm still not fully back. I think once I get the drain out, I think that'll be a lot easier. Hopefully alleviate myself, because I'm really preoccupied about the drain and how it's not always draining and making sure it's draining. It's just,
I mean, I guess the good thing is that we already anticipated a 4 to 6 week recovery. So even though the surgery didn't go the way they thought it would go, like, I think mentally and like somewhat physically we were already kind of prepared this is going to take a long time. So you know, we were pretty set for
6 weeks.
For 6 weeks of him not being able to do much. So like the moments that he can do things have been like extremely helpful. But the anticipation hasn't really been, you know.
I'm going to be around.
Yeah, much more. So it's been kind of nice because he kind of can do like at least like he's done bath time with Noel and like loaded the dishwasher, and like, you know, it's the small things take a load off of me, because then it's like one less thing I have to remember or like worry about, especially at the end of the day. Like, it is a lot to, you know, do everything for him and then, you know, still manage her and then myself. So even like those little tiny things, those little tiny moments that I can like get a break. I even got to go to like dinner with my girlfriends because he was like full enough to like stay up in his chair long enough to like hang out with her and then put her to bed. So like it kind of helps that everybody kind of still gets something for themselves in this time frame.
Yeah. After this, I'm going back in bed. I'll be wanting to spend time with my wife, sit on the couch, but
yeah, we got to do that one night.
Yeah, I don't know. My body just not back to itself.
It's the spring, so the weather changes don't really help, because we kind of like, it got warm enough some days like not need the heat on, so we kind of turned it off. But then like now you have those days that are lingering again and a little bit more chilly.
You know, I don't like that.
Yeah,
you can go back to body regulation. I hate spring. I hate spring so much. But my recovery is doing good. I'm doing good. I thank everyone for the well wishes, the prayers, the calls, the texts, the Facebooks.
The meal train.
The meal train was
the meal train has been such a
biggest blessing in the world. Yeah. I don't think we've cooked.
No, I probably gained
I'm so
many
fat.
pounds, but like
I am so fat right now.
Worth it to not have to worry about like cooking as much.
But it'd be so worth it. Sometimes you just be like, I don't want that. I want this. So I'm so grateful for the meal train. I'm so grateful for everyone that donated. Like I said, the calls, the texts, even if you didn't donate, just looking out, you know, my people that look out, the hopefuls, people we never know, met before. I thank you.
So many people that we have never ever met in person who have been like our biggest cheerleaders.
Yeah, I'm coming back stronger than ever. I've been getting around, so I give myself about another month from now. I should be back totally.
Yeah. So physical therapy discharged you
further this week,
and then his nurses are like down to once a week.
Yeah,
which is like very bittersweet, because like the whole time we've been living here, they've been here 3 days a week.
They like
now, they're like family. So now they're down to like 1 day a week. So we have to prepare to say goodbye to them and get her a really nice gift.
I'm keeping her on as my urologist. But I think that's it. Like I said, y'all guys been here. I've been wanting to do this video for a while. I'm glad I'm able to. I feel okay. I just got to get my body back. I knew it was going to take some time. Thankful that I did not have to do the crazy surgery and the crazy recovery. I don't think I would have lasted. I think I would have lost my mind if I had to be on my stomach.
That would have been really hard.
I was trying to be too independent. I'm trying to be too independent as it is. So I think.
the day you came home, Noel jumped in the bed with you.
Yeah.
She like missed you so much. I couldn't imagine. It's so hard to explain to a 3-year-old like what she can and can't do.
Yeah.
Yeah,
that would have sucked. God knew what he was doing. Like I said, I'm not mad at all that we waited. We could have did this surgery last year, and I think it went horribly wrong. I think it would have went horribly wrong if we did it last year.
Our support system has changed since then.
Yeah. That big ziti.
I mean, even our therapists, like just the way we approach things and look at things.
Yeah. So this is such a blessing. This is perfect. It's worked out. That's why I waited. I knew it was a reason why I wanted to wait. I'm not one to say I hear from God, but I knew it was a reason to wait.
I mean, even with the weather being a little bit nicer to get her out the house.
Yeah, perfect timing for that too. Yeah, like there's just little breaks.
Yeah, it's been nice.
So that's it, guys. That's all I have for you this week.
Be tired.
Yeah. I appreciate you. I really appreciate you from the bottom of my heart. I thank y'all. Thank y'all for doing this journey with us. And keep watching because we got something crazy going on in July. 4th of July weekend.
See you guys soon. Bye. Oh, don't forget to like, share, and subscribe, guys. See you guys soon.